I am Dr. Vinod Kumar. As always, my interest is about improving the quality of life in old age. Today, I would be talking about what happens to a diabetic patient when he also has coexisting dementia. As you know, dementia, a disease about forgetfulness, particularly common in old age, is something which in early stages is often confused with normal aging process. However, dementia is much more about problems of memory, problem of recognizing persons and objects, and finally depending partially or completely on his family member or any formal caregiver. In dementia, if there is diabetes also, the process of forgetfulness and other features of dementia, they occur more frequently among diabetic patients. They occur faster in diabetic patients. So let us examine what happens when these two age-related diseases are existing together in the same elderly individual. Firstly, a demented patient who also has diabetes will find a lot of difficulty in managing his diabetes disease by himself. But others who are not dementia patients, they have no such problem. So why they have problem if they have dementia? Because they have the problem of forgetfulness. They sometimes forget taking medicine. They sometimes take the anti-diabetic medicine in wrong doses. And sometimes they have even difficulty in identifying the anti-diabetic tablets. So the result is that their diabetes goes out of control and their blood sugars become high and they have all the problems connected with the uncontrolled diabetes. On the other hand, if a diabetic patient takes his medicine twice, because he might have forgotten they had already taken once, but if he takes the medicine twice, or if he misses a meal, he forgets taking his food, what will happen? He may end up in dangerously low blood sugar called hypoglycemia. It's a very risky proposition, particularly in old age. And if such a patient also often forgets taking enough water, he may land up in dehydration and confusion. Such confusion, coupled with disorientation of space, makes them sometimes forget the location of their toilet in their own house, particularly in the night when it is dark. So what will happen? They are not able to hold the urine for long and they start suffering from what is called urinary incontinence. Again, because of the dark nights, because finding difficulty in locating the washrooms or toilet, they are liable to fall, they are liable to injure, they are liable to contract even fractures. So these are the problems that a diabetic patient may face when he has dementia, early, intermediate, and more in the late stages. So what do we do about it? I have three recommendations to tide over these problems. Firstly, every diabetic patient above the age of 65 must undergo screening, annual screening at least, for early detection of dementia. Because early detection of any cognitive impairment or dementia will go a long way in keeping them independent and able to manage their diabetes and other issues in day-to-day life for a longer time. The second recommendation is that such diabetic patients must be under the care of diabetologist who prescribes the medicines for diabetes which are not harmful for dementia. Rather, some of them may be useful for dementia. And no such medicine should be given by the treating doctor which has the potential to aggravate dementia. And the last or the third recommendation is that once a diabetic patient who has developed dementia of certain magnitude and needs the help of a caregiver, the services of a caregiver, whether an informal caregiver in the form of a family member or a paid formal caregiver who is trained, should be available to give him day-to-day help and care for his diabetes and other issues in life. Thank you very much.